Good day, everyone, and welcome to the second episode of the webinar series Unbottling the Truth, brought to you by the UP Manila National Institutes of Health Promotion Program. Today's topic is preventing drink driving for safer roads. My name is Bill Wilson Balhan, and I'll be your moderator for today. In commemoration of the World Day of Remembrance for road traffic victims, we will delve into the critical issue of drink driving and its devastating consequences on road safety in the Philippines. Combining alcohol consumption and driving is a deadly mix. And today, we'll learn about evidence based strategies to prevent drink driving and discuss the challenges of implementing Republic Act number 10586, the Philippine Anti Drunk and Drug Driving Act. Our esteemed speaker, Ms. Dinna Louise C, Dayao, who will guide us through these discussions, bringing her expertise in communication and advocacy to shed light on this urgent issue. For everyone's guidance, this webinar will begin with a short presentation, which will run for about 30 minutes. Afterward, we'll move on to a quick Q&A session. And since this is pre-recorded, we will be answering your questions after this webinar is posted. So we encourage everyone to leave their questions in the comment section. We will compile them and respond to them through email or social media after the webinar. Now, it's my honor to introduce our speaker for today, Ms. Dinna Louise C. Dayao. Dinna Louise C. Dayao is a communication consultant for the Move as One Coalition, a civil society organization that advocates for safety, more humane, and more inclusive public transportation in the Philippines. Ms. Dayao is an independent journalist and Pulitzer Center grantee for her project reporting on road safety in the Philippines. She completed the Global Road Safety Leadership course organized by Johns Hopkins International Injury Research Institute, Global Road Safety Partnership, and Bloomberg Initiative for Global Road Safety in 2017. Today, she will discuss the lethal consequences of drink driving, strategies to prevent it, and the barriers to effectively enforcing our anti drunk driving law. Ms. Dayao, the floor is yours.
Thank you for this opportunity to discuss an important issue, which is drink driving. Drink driving affects all of us, whether or not we drink alcohol and then drive. The title of my presentation is Want to Save Lives on the Road? Alak no more before driving. Today, I'll talk about the dangers of drink driving in the Philippines and worldwide. I'll discuss some strategies that governments have taken to curb and prevent drink driving. I'll paint a picture of the challenges involved in implementing RA 10586 in the Philippines. Lastly, I'll suggest steps all of us can take to prevent drink driving. Malapit na ang Pasko. Siguro marami sa atin ay excited nang nagpaplano ng Christmas party o reunion. Babahaba ng alak o beer sa Christmas party ninyo? Para sa maraming Pinoy kasi, hindi kumpletong okasyon kung walang inuming nakalalasing. Alak pa more, sabi nga nila. Widespread alcohol marketing has normalized and glamorized alcohol consumption. We can even order bottles of alcohol online. The sad result, though, is that many of us are blind to the dangers of drink driving. Alak pa more ang gusto ng marami, kahit na magmamaneho o magmomotorsiklo sila pagkatapos. Mali ito. Buwis buhay ang gawain ito para sa taong uminom ng alak at sa mga taong nasa paligid niya. On December 22, 2023, a man who was reportedly drunk plowed into a crowd outside the church in Ilocos Sur. Literal na inararo ng lasing na driver ang mga taong kagagaling lang sa simbang gabi. As a result, 3 children had serious injuries such as head trauma and leg fracture. One of them was left in a coma. Ang lungkot siguro ng Pasko nila at ng pamilya nila. This tragedy and many others like it are preventable. The simplest rule is the safest. If you drink alcohol, even one drink, don't drive. The World Health Organization says that just one drink can affect a driver's reflexes, coordination, and ability to identify risks on the road. Napakadilim pa naman ng mga lansangan natin at madalas ay baku-bako. Napakahirap magmaneho ng maayos. What more if you have had a drink? The person who drinks even one drink is impaired and can pose risks to himself and to others around him or her. Drink driving is a big problem in the country. Every day, 3 people don't make it home alive because someone made the wrong decision to have a drink or 2 or 3 and then get behind the wheel. This is according to data from the Global Burden of Disease Study 2021. Here are the grim numbers from that study. They show that the people who drink and drive are behind the deaths of 3 people on Philippine roads every day. Napakarami ang namamatay dahil sa alak pa more at happy hour sa mga bar. Drink driving is a public health concern all over the globe. Between 5% and 35% of global road deaths are alcohol related, according to a 2022 publication. Siguro sasabihin ng taong umiinom ng alak at nagmamaneho, katawan ko to. Ako lang naman ang maapektuhan ng pag-inom ko. Pero hindi ito totoo. Malalagay din sa alanganin ang ibang tao. Drink driving affects more than the alcohol user. In a 2019 WHO report, half of the deaths from alcohol-related road crashes worldwide were caused by someone else's drinking. Napakarami naman ang namamatay. Behind the headline, surviving driver in fatal EDSA road crash found to be over alcohol limit, is a very sad story. The driver and his 3 colleagues went to a party in February 2022. The driver drank alcohol and then drove the car. The vehicle smashed into concrete barriers lining the EDSA busway, burst into flames, and burned all his companions to death. The driver, the man, was the only one rescued by other motorists. The motorist fled because the car emitted smoke and they were afraid that the car would explode. Napakalungkot siguro nung driver na yon na namatay ang mga kasamahan niya. Nagaling lamang sila sa isang party na sana'y naging masaya sila pero nauwi sa kamatayan ng tatlong mga kaibigan niya. The good news is that solutions exist. There are two things governments can do to effectively prevent drink driving. Number one is raising taxes on alcohol. One study showed that doubling the alcohol tax would reduce traffic crash deaths by 11%. Kapag kasi tinaas ang buwis sa alcohol, tataasin ang presyo ng mga inuming nakalalasing. Magdadalawang isip ang mga tao bago sila bumili ng alak. Uunahin pa ba naman nila ang bisyo kaysa sa pagkain, gamot, at school supplies ng mga anak nila? Hindi, di ba? Kaya lang, ang malungkot, hindi pa nangyayari ito sa Pilipinas. Ayon sa mga eksperto, hindi sapat ang pagtaas ng buwis sa alak at mga inuming nakalalasing para mabawasan ang mga taong umiinom nito. Ipinaglalaban pa ng mga advocates na taasan pa ang buwis. Another thing that governments can do to prevent drink driving and save lives on the road is to enact drink driving countermeasures, including random breath testing. Let me explain. Australia's sustained drink driving program has been extensively studied. It is considered a good practice. Australia's law includes highly visible random breath testing. The word random means that anyone, any driver, at any time, anywhere, can be tested for alcohol. Random breath testing was first introduced in the state of Victoria in 1976. This photo shows a member of the Victoria Police Force who is using a breath alcohol analyzer or breathalyzer. The breathalyzer shows the amount of alcohol in the person's bloodstream. The result is available in seconds. So this gadget that we see here in this photo is used to prove that the person who is suspected of driving under the influence of alcohol actually has alcohol in his or her blood. In Australia, no one can refuse an alcohol breath test. There will be penalties for doing so. Australia's program has saved lives. It has also resulted in a changed attitude towards alcohol. Over a 30-year period, Australia's program has cut alcohol as a factor in crashes by almost half. That's quite a dramatic improvement. In addition, the community now sees drink driving as socially irresponsible behavior. Ang ibig sabihin, alcohol no more before driving is cool in Australia. Hindi sila naniniwala sa alcohol pa more, lalo na't kung magmamaneho. Random breath testing has effectively reduced drink driving in countries like Finland, New Zealand, and Ireland. Random breath testing is done in Asian countries such as Indonesia, Malaysia, and Vietnam. However, random breath testing is not done in the Philippines, and I will explain how and why in the next slides. First, a bit of good news. The Philippines has a drink driving law, Republic Act 10586, or the Anti-Drunk and Drugged Driving Act of 2013. The bad news is that RA 10586 is poorly implemented due to a lack of breathalyzers. Kamakailan sa Senado, nagkaroon ng mga pagdinig tungkol dito. At napag-alaman na kakaunti ang breathalyzers na gumagana sa buong Pilipinas. There are 756 breathalyzers, most of which are defective. There simply isn't enough equipment to test the 7.8 million licensed drivers in the country. Napakalungkot naman. Ang mahal-mahal nung breathalyzer. Pero kulang na, sira pa. But wait, there's more. We taxpayers paid 51.4 million pesos for the 756 breathalyzers. Pera natin yun na ipinambili ng palpak na breathalyzer. Isn't it time we called on the government to invest in enough calibrated breathalyzers and to stop wasting taxpayer money, which is our money? Another challenge in enforcing RA 10586 there are too few trained law enforcers. The Land Transportation Office is in charge of implementing RA 10586. However, the LTO has not stated how many law enforcers there are to enforce the act. Sa madaling sabi, naging palpak ang implementasyon ng RA 10586. In short, the lack of breathalyzers cannot help law enforcers prove that the person is driving under the influence of alcohol. Kasi kapag ginamit ang breath alcohol analyzer ng tao, may lalabas na dokumento na nagpapatunay na ang dami ng alcohol sa dugo niya ay sobra na sa legal limit. Kaagad-agad yon. Ang sabi nga nila, that document has evidentiary value. Pwedeng dalhin sa korte. Ngayon, kung walang breathalyzer, wala yung document na yon. No? Without concrete proof, the enforcers worry that the motorists they apprehend may harm or sue them. Isipin nyo naman, yung mga law enforcers, ang shift nila, madalas, 10:00 ng gabi hanggang 2:00 ng umaga. Tapos, titigil nila, papatigilin nila yung sasakyan na hinihinalang nagmamaneho ay isang taong no. Pero hindi nila matest yung taong yon. Natural magagalit yon. At baka sakta ng mga law enforcers o kaya idemanda. The end results are the lax implementation of RA 10586 and the high numbers of people killed on Philippine roads because of drink driving. Let's not wait for government to get its act together. There are things we can do right here and right now to prevent drink driving. How about planning an alcohol-free party? There are many fun, flavorful, and healthier alternatives to alcohol. Subukan natin at baka magustuhan natin. Let's think before we drink. Ang desisyon na uminom ng alak ay hindi lamang makakaapekto sa atin kung hindi sa ibang mga taong nasa paligid natin. Okay, nag-isip ka na at gusto mo talagang uminom. Before you drink is the best time to plan how you'll get home without driving. Will you book a Grab? Will you ask someone to drive you home? Or will you take public transportation? At the same time, how will the other people at the party who want to drink, your colleagues, your friends, or family members, how will they get home safely? Napakalungkot naman kung may mangyaring masama sa kanila dahil hindi ito napagplanuhan. Linangin sana natin ang ating kaisipan. Do look up the Action for Economic Reforms, a think tank advocating for higher alcohol taxes. You can also check out this article by Gianna Gail Amol, a Filipina PhD student at the University of Geneva. At huwag nating kaligtaan na kailangang bantayan ang mga balita tungkol sa implementasyon ng RA 10586. The more we learn about the dangers of drink driving, the more we can act to make everyone safer on the roads. The more we know, the more likely we are to say, tama na ang buwis buhay, naalak pa more. Bagong buhay naman. Alak no more naman before driving. Let me end with a simple message. Simplest is safest. In September, American singer Justin Timberlake pleaded guilty to driving while under the influence of alcohol. And this is what he said: even if you've had one drink, don't get behind the wheel of a car. Thank you, everyone, for listening. Let's all enjoy the holidays in safety and work together to make the roads safer for everybody. Salamat po.
Thank you, Ms. Dayao, for that compelling presentation. So now we're moving on to our Q&A session. So for everyone tuning in online, please feel free to leave your questions in the comment section. We'll address them in the coming days, so don't hesitate to share your thoughts and inquiries. Okay, so thank you po ulit, Miss Dina. First question po, you mentioned two challenges of RA 10586. Lack of breathalyzers po and too few trained personnel. So we'd like to ask if there are any other challenges you think there are, and how do you think all of these challenges can be addressed po?
Okay. The two challenges I mentioned are crucial, are essential to strict enforcement and proper implementation of RA 10586. Like I mentioned, the breathalyzers are used so that the law enforcer can generate a report immediately after giving the test to the person suspected of driving under the influence. After that person blows into the device, within minutes, a report is generated that will show whether or not that person's blood alcohol content is above the legal limit, which is 0.05 grams per deciliter, as stated in RA 10586. Now, I was told that this result, this paper, it's actually printed on special paper that does not fade. And that is because it has evidentiary value. You can bring it to court. First of all, you can show it to the person and say, you are driving above the legal blood alcohol content. Therefore, you are driving impaired. Therefore, we can apprehend you. Now, at the same time, you can bring that to court and show proof, it is concrete proof, that that person violated the law. Without this proof, the law enforcer will have a hard time apprehending the person suspected of drink driving. And I think this is the reason why the lack of breathalyzers hampers the law enforcer's ability to do his or her job well. The law enforcers do a thankless job. They work at night from 10 a.m., 10 p.m. to 2 a.m. So it's dark. They need to have proof. They need to show, they need to have witnessed a violation which they suspect is due to drink driving. For example, if the driver runs a red light, then that is a violation, and they can go to that person and say, first, do a sobriety test. 3 sobriety tests. So these are physical tests. Then, if that person fails the sobriety test, the breath alcohol analyzer is used on that person. The law enforcer trying to do this at night without a breathalyzer of course, has reason to fear for his or her safety. And this is one of the reasons why too few people want to do this job. It's a thankless job, and they risk being sued or physically harmed by the person they are trying to apprehend. These are two very important challenges that we need to overcome. Um, and I think they stem from a lack of political will, a lack of urgency in uh, our government, our decision makers. The law has been around since 2013. So after 11 years, we still only have 756 breathalyzers, most of which are defective. So we have to work on this. Our government needs to get its act together. And advocates, all of us who are road users who deserve to be safe on the roads, must call on government to invest in the life-saving equipment and trained enforcers to fully and properly implement RA 10586.
Okay, so with that po, how do you think law enforcement officers po can be better equipped or trained to handle cases of drink driving more effectively now po sa Philippines?
There is um, definitely a lack of support, a lack of training, and I hear a lack of compensation for law enforcement officers. Now, this is an important issue. Drink driving is the reason why 3 people don't make it home alive every day in our country. Of the 10 people who die every day on our roads, 3 of their deaths has been attributed to alcohol. That is quite alarming. That is an unacceptable loss of lives. Now, um, we need to push for the proper implementation of RA 10586. The government needs to get its act together and allot sufficient funds, because allotting sufficient funds will not only save lives, uh, the loss of lives on our roads due to drink driving and other causes also burdens our public health system and drains our economy's GDP. So there is a peso value. There is a business case to be made for investing in road safety. We increase people's safety, we increase their quality of life, we save money, and this is taxpayer money, right? And all that money can be better spent on things that benefit all Filipinos, right? The money saved could be spent on protected bike lanes, for example, playgrounds, libraries, um, more hospitals, better healthcare for our people. So there needs to be a clear and urgent focus on road safety in general and on drink driving in particular.
Thank you so much for that po. And while we're in the topic po of RA 10586, do you think po there are sufficient penalties under the Republic Act to deter drink driving? And if not po, what changes would you recommend for the RA?
Okay. From what I've read, The penalties are often, it is not the amount or it's not the severity of the penalties that deters unsafe road behavior like drink driving. I hear there are moves to increase the penalties to 1 million pesos or some such amount. Um, I did not touch on the penalty so much because it's actually not the amount that varies that matters. It is the swiftness and sureness of implementing the law. If the penalty, say, is only 1,000 pesos, but the driver is sure to get penalized and will be issued other sanctions and possibly have his or her license revoked for repeated offenses, then that will better deter drink driving than the amount of the penalties. The problem is that because we lack calibrated breath alcohol analyzers and we lack trained officers, the implementation of the law is not swift. It is actually very lax. It is not swift and penalties are not sure. Therefore, no deterrence will take place. I would suggest that our law be amended to include random breath testing, which has saved lives in countries like Australia and Ireland. Random breath testing means that any driver can be stopped anytime, anywhere by a police officer, even before that driver commits a violation. Random breath testing is not allowed under our law right now. Under RA 10586, the law enforcer needs to have a cause to stop the person suspected of drink driving. There needs to be a violation. And this is a violation that the officer sees. So it's very hard to determine, right? How will the enforcer know that the motorist is speeding, for example? We don't have speed guns. The non-contact apprehension program of MMDA is currently on hold. So having random breath testing is a preemptive step. The law enforcer does not wait for a reason to stop any driver, anytime, anywhere, and ask that person to take a test. In Australia, this is highly visible. No, I've shown some pictures. They do it during the day. They have signs. The enforcers have signs. The drivers cannot refuse because that would be considered an offense. So they do this often enough so that people have accepted it and people have changed their minds. The Australians now view drink driving as irresponsible behavior. Many people in Australia still die because of drink driving, but the numbers have fallen dramatically due to the country's sustained drink driving program, which includes random breath testing, public education programs, and community involvement. So for me, random breath testing should be done in our country. But that, again, going back to the lack of breathalyzers, that is impossible to do now because we have only 756 breathalyzers for 7.8 million licensed drivers. So we go back to that problem. We need more calibrated breathalyzers. And we need more trained law enforcers. And these will enable us to carry out random breath testing, save lives, and make drink driving a socially unacceptable behavior.
Thank you so much po. And I think po coming from your answer, you mentioned po about drink driving is socially irresponsible po in Australia now. Although I think po in the Philippines, we still have a long way to go since
Mhm.
may naririnig po ako personally na people are saying it's better to drive ng lasing po kesa it is to drive ng inaantok. May mga ganun pa po tayong misconceptions within the country. So I wanted to ask you lang po, what do you think are some of the misconceptions po about drink driving that we should be able to correct po through the public education campaigns na nagagawa na rin po sa mga ibang bansa?
Okay. First of all, it's a myth that the majority of Filipinos drink alcohol. According to DOH, 49% do not drink alcohol. So that's still a big number. That's a significant number. But of course, the 49% will not make noise and proudly say, I don't drink. Because widespread alcohol marketing has just glamorized and normalized alcohol consumption. The two most popular basketball teams are named after alcohol products. The biggest alcohol company in the country has been holding an Oktoberfest since 1982. And this event is considered an official Department of Tourism event. That is appalling. That makes it normal. That makes it, look like really Filipinos like drinking. It's happier when we drink. It's happier when you get drunk. No, alak pa more, di ba? Even our language is quite telling. When we say nakainom instead of uminom. No, when you say nakainom, it's like you did not mean to consume alcohol, but of course you did, right? You bought the drink or it was offered to you and you took it. So our language needs to be changed. The narrative that alak pa more is macho, is good, is cool, needs to be changed. Even the saying that, when we tell our friends, painom ka naman, right? It makes it normal. It's like, it's a reward. Drinking is a reward. Drinking is fun. Drinking is something that you do with friends and family to celebrate. And I get that. The problem is drinking and driving do not mix at all, right? The WHO says you need not be drunk to be impaired while driving. Even a low level will make you uninhibited, will impair your judgment, will slow down your reflexes. So the bottom line is, if you are going to drink at all, not even one drink, don't drive. As for sleepiness being a factor, it is a factor, but one cannot say that one is less harmful than the other. A person may be sleepy because that person might have taken alcohol. Or that person might be a truck driver trying to beat the deadline, staying up late so that he can deliver goods on time. So it is not appropriate, it is not correct to say that one is worse than the other, one is safer than the other. Both are unsafe. Both are unsafe. Um, I was trying to stress in my presentation that we need to educate ourselves about the dangers of drink driving. Too many people are dying on our roads because someone decided to drink and then drive. These innocent parties include pedestrians, children, senior citizens, cyclists. So these people who have nothing to do with the person's decision to drink and then drive are negatively affected by that person's wrong decision.
Okay, thank you so much po. And I think coming from your last answer din po, we see that drink driving affects so many communities. So right now po, how can local communities or organizations po collaborate or initiate events to promote road safety awareness po, lalo in the discussion po of drink driving?
Sadly, I don't know of any um, local community organizations that have worked together to combat drink driving. I would point to think tanks like the Action for Economic Reforms, because they are advocating for higher alcohol taxes. I also know that a public law group called Imagine Law has undertaken a road safety advocacy. They have not focused specifically on drink driving, though. I think someone does need to step up and say, tama na, tama na yung buwis buhay na alak pa more. Baguhin na natin, bagong buhay na sana, bagong buhay na dapat alak no more, especially before driving. In America, there is a group called Mothers Against Drunk Driving, and they have consistently called for actions to stop drink driving in the States. Siguro at the community level, let's start where we are. First of all, let's educate ourselves about the harms of drink driving. Let's question the narrative that drinking is good for you, it's good for your health, because it is not. The WHO is a good source of information about the harms of alcohol on your health and the negative effects of alcohol on road safety. Then, where we are, let's rethink our views towards alcohol. Let's make it less normal. After all, alcohol is a sin product. It is not an essential product. It is not something that we need to survive, right? So, starting perhaps with the parties that we are organizing this Christmas and for New Year's even, let's consider having alcohol-free gatherings. Uso naman ngayon yung mga fruit-infused water, di ba? And shakes, fruit shakes, juices. These alternatives are fun also and healthier than alcohol. Tapos, bantayan din natin yung nangyayari sa Senado. yung mga deliberasyon tungkol sa RA 10586. Sinabi ko nga sa presentation ko, ang mahal-mahal ng breathalyzer, 68,000 pesos ang isa. So, pera natin yun. Yung 256 breathalyzers, 51.4 million pesos yon. Hindi bariya-bariya yon, pera natin yon. Buwis natin yon. Kailangan bantayan natin kung paano ginagastos yung buwis natin. Kasi naghihirap tayo magbayad nun. At kailangan makinabang tayo. Kailangan maipatupad ng maayos ang RA 10586 para masulit naman yung buwis natin at saka para maging ligtas tayong lahat sa lansangan. Masyadong marami ang namamatay o kaya ay nasasaktan sa mga lansangan natin. Hindi ito dapat nangyayari dahil maraming paraan para maging ligtas ang biyahe ng lahat sa atin sa ating mga lansangan.
Thank you so much po, Miss Dina. So for the interest of time po, we'd like to ask you if you have any final remarks or a message po you want to give to our audience po for today.
I'd like to keep it simple because simplest is safest. When it comes to drink driving, zero alcohol before driving is the safest. Let's keep it simple. You only have two choices. We only have two choices. We drink or we drive. It is not and. If we want to drink, let's plan for how we are going to get home safely without driving. Let's do this before drinking, right? So that we are not impaired yet, right? Because it would be very sad if we come from any party, any holiday gathering, and we don't plan our trips home, and we get involved in a road crash, we get hurt. Possibly we may die in a road crash, or someone at that party may also want to drink and drive. We have to think of that person also. That person could be our friend, our family member, our colleague. Now, the time to plan how they will get home safely without driving is before the actual party, right? There are many ways now. There is Grab, there is public transportation up to a certain point. We can possibly request people to not drink and drive. This is called the designated driver program. We can hire a driver to drive our vehicles so that we don't have to do it ourselves while we are impaired by alcohol. Simplest is safest. My other message really is, let's try something new. Nakakasawa na rin yung alak pa more. Shot puno. Oh. Siguro tama na isipin natin na okay lang yun. Minsan lang naman. Minsan lang naman iinom. Konti lang naman. Ang problema kasi yung konti lang na yun, makakaapekto sa pagmamaneho. Babagal ang reflexes. Babagal ang galaw, no? Ang instincts, no? Ang gulo-gulo pa naman ng kasada natin, ang dilim-dilim, ang hirap-hirap magmaneho ng maayos. Yung hindi ka nakainom, mahirap nang gawin yon. O kung hindi ka uminom, mahirap nang gawin yon. Kung uminom ka, mas doble siguro ang hirap na makapagmaneho ka ng maayos. So sana maisip natin yon. Ngayong Pasko, simulan natin ngayong Pasko. Kung iinom, huwag magmamaneho. Kung magmamaneho, gumawa ng ibang plano para makauwi ng ligtas ng hindi nagmamaneho. Kasi gusto naman nating lahat na maging masaya ang Pasko natin, kompleto ang pamilya natin, ligtas tayong lahat. So sana isipin natin yun, simulan natin na isipin kung paano mangyayari yun sa Pilipinas, sa buong bansa natin. Para maging masaya tayo, maging ligtas tayo.
Okay, thank you so much po. So that brings us to the end of today's session. On behalf po of the UP Manila National Institute of Health Promotion Program, we would like to extend po our heartfelt thanks for your insightful presentation. Your expertise po has truly been invaluable in raising awareness about the dangers of drink driving and the need for safer roads in the Philippines. We also want to thank everyone po who joined us today and shared their questions. Your participations fuel these important conversations and inspire action toward our shared goal of a safer and healthier society. So as we continue with our Unbottling the Truth webinar series, we invite everyone to join us for our next episode, which will explore another crucial topic in alcohol harm prevention. And also don't forget to follow our social media pages to stay updated on future events. Thank you once again. And Miss Dina, we'd like to invite you to a quick picture opportunity.